There are not many former First Ladies of America. And when one of them puts her shoulder to the wheel and says, I'm going to work on this, and keeps at it for 30 plus years, there is an effect. To say it's important is an understatement.
One is to speak out and get people talking about mental illness so that everybody in our country can realize that it's just an illness like any other illness.
We know that mental illness is a disease as any other. It can be diagnosed, it can be treated, and almost everyone suffering from mental illness can be helped.
I really wanted to thank you. I think your presence...
The Carter Center and Mrs. Carter's leadership has provided a ray of hope.
The Carter Center is quite unique in the mental health field in that all of the issues that we get involved in, we offer a voice that is unrepresented elsewhere. We conduct a major symposium on mental health policy every year that brings together thought leaders in the field.
I can't tell you how much the support of the Carter Center meant to me when I was Surgeon General. Every time I released a report, I would be on a program to present at the Carter Center the next year.
Hello and welcome to our ABC 7 News special, Surviving Suicide. I'm Kevin Roy, and I am a survivor of suicide. That loss has been the driving force behind a special series of reports that ABC 7 has produced over the past year in conjunction with the Carter Center in Atlanta.
One of my best programs are mental health fellowships for journalists, because we were brainstorming one day, what else can we do to overcome stigma? And somebody said, why don't we educate journalists so they'll know the issues, know what we know about mental health issues, and then can report it accurately. And it's been really successful. When I became involved in Georgia, nobody would talk about mental illness. Nobody wanted to be involved with the issue. Less than a month after Jimmy was in office, he passed a resolution calling for a President's Commission on Mental Health. We worked for 4 years, made a list of recommendations, and actually got them into a bill and got the bill passed.
Mrs. Carter is able to walk through doors that mortals can't usually get through. A good example of that is the parity discussions, and we've watched this for years.
Parity, very simply, is ensuring that people with mental illnesses receive the coverage in private insurance plans at the same level that any other health condition is covered by. She was dogged in her determination to keep that issue in the forefront. She testified before a key House committee on her concerns and issues associated with parity and her sincere wish that it get passed.
Parity passed through Congress. It's something that my President's Commission on Mental Health in 1978 recommended. I mean, I've worked on trying to get parity passed all these years. Nothing comes easy.
A lot of the stigma, I think, goes back to the times when everybody who had a mental illness went to an institution, or we think of them in that way. That is not the case now.
One thing I don't understand is why there's so much stigma, because everybody in this country is touched by it. If not a member of the family, then a close friend or a relative. 1 in every 5 people in our country will suffer a mental illness this year. Changing attitudes takes time. It's very difficult, and I know because, as I said, I've been working.
She is seen as someone who speaks the truth, who speaks with an authenticity that's recognized by all. She is a person who walks in a room and the chemistry in the room changes.
Mrs. Carter brings a moral authority to discussions about mental health. She has demonstrated by a lifelong commitment that the people who are affected by these no-fault disorders deserve respect, they deserve access to treatment, and they deserve dignity.
The attitudes are changing. And I think even stigma, for the first time, and I've been working on this for more than 35 years, for the first time in my lifetime, I feel stigma is moving a little bit, lifting a little bit.